80% of Americans will suffer some type of back pain in their lives, and current estimates of medical care for those who have been disabled by severe back pain in the U.S. range from $30 to $70 billion annually.
I'm doing a favor for somebody that was a big help to me on a physical level for sure, and certainly a personal one as well, which was quite surprising. Up to the very end of my treatment, I had the record for the worst damage he'd ever put on his IDD plan. It was kind of risky for me. Insurance doesn't cover it yet, and but I was looking at surgeries and talking to Dr. Thomas. I trusted him. He's very sincere about his craft and cares a lot about his patients.
At 14.3 million office visits per year, back pain is the second most frequently reported reason for a doctor's visitation.
My arm was locked up like this by the time I'd come here. I couldn't even put it down. I went to the hospital and they said, here, you want some pain pills, which is another story.
Non-prescription NSAID manufacturers have been asked to revise labeling to include specific details about cardiovascular and gastrointestinal side effects. These include ibuprofen and naproxen. These dangerous drugs are components in many over-the-counter drugs, including Advil, Motrin, and Aleve.
I had either 3 or 4 discs that were ruptured, and calcium was building up on my spine. The treatment was amazingly pleasant, barely painful. He's very cooperative and kind. His staff was real good. So I actually bought him a Mexican cake. Anyhow, the pain, it was only within 2 weeks when my arm was down. And within a month I had no pain, no numbness, because my whole side was getting numb by the time I made it here. I made a personal effort to work with the insurance companies to try, and I still believe this is something that needs to be done. I didn't have any luck, but this treatment needs to be insured. It is far more effective, far less intrusive than surgery, and far less risky.
Although the overall occurrence of back pain is similar in men and women, a greater percentage of men, 61%, experience lower back pain than women, at 51.2%.
This works. It works for me. I have not had a problem with my back in almost 2 years. It was a little trying, because I had to, twice a day, but he created the best environment possible to deal with something like that. And I just can't stress enough knowing people that have had back surgery, knowing people who had that little accidental cut on their spine. My wife had that situation, and she was basically in a wheelchair for 6 months. The damage in her back wasn't nearly as severe as mine.
Various medical offices around the country are touting the benefits of Spinal with IDD therapy as an alternative to typical medical protocols for dealing with back pain.
It's amazing the difference it made, and how good he does. He really is as good as it gets. He's supportive, he's encouraging, he clearly explains the process, which I really appreciated early on, was when he showed me exactly what these things right here, all his little toys, let me show them to you here. So you got different spines, and anyhow, I believe in the process. I believe that should be the first thing that should be done before anybody lets a knife get anywhere near their spine.
The Spinal with IDD therapy protocols, manufactured by North American Medical Corporation, is a non-invasive medical procedure that has a 92% success rate in treating herniated, bulging, degenerated disc, sciatica, and lower back pain.
I didn't have to get carved on and risk permanent spinal damage. And that's because of Dr. Thomas. I would recommend him to anybody. I would recommend that process. Thanks. I love you, Doc. Take it easy.
For more information, call 770-460-1911 or visit www.livingpainfree.com.